Hello, I want to discuss the clinical implications of mutations in AML today. There has been some interesting news with that regard. Recently, the European Leukemia Net guidelines were updated, and there were new mutations entered into the guidelines. That means today we have to look at more mutations to better stratify our patients. There is new high-risk markers like p53 mutations, ASXL1 mutations and RUNX1 mutations that classify patients into unfavorable risk group, and those, for example, would be patients that at our institution would move forward to transplant. In addition, we now also know that the dosage of the mutations is responsible for how patients are doing. For example, with regard to tyrosine kinase domain mutations, we now also look at the mutational burden. If you have a high mutational load, that means that you're also doing worse than with a low mutational load. And the other interesting thing now is that with the approval of the drug midostaurin for FLT3 mutations, we now also have a targeted therapy available. And there is other mutations like IDH mutations where there is also new small molecules on the horizon that might change the management of leukemia treatment in the future.